As a citizen of Hong Kong, do you know the social policy of the elders and why it's important for the elders? The reason is everyone must getting older through every year and become elders. Most likely they will retire at around 65 years old under the retirement policy set by the government. According to the figures, the life expectancy at birth for women are 86.8 years and for male is 80.7 years. They need to live more than 10 to 15 years without any incomes. However, the social elderly policy is very important for them. Therefore, some people may choose another country to spend their retirements. Canada is one of the popular choice. These videos will talk about the social policy of the elderly, such as finance, medical support, and social service between Hong Kong and Canada.
To start with, let's find out the difference between finance supporting policy for the elderly in Hong Kong and Canada, and you can think about which is better for you. As you can see in the table, in Hong Kong, the basic monthly standard rates for the elderly individuals under comprehensive social security assistance are 3,585 in Hong Kong dollar for single adults and age 65 years old or above, and 2,225 Hong Kong dollar for each eligible adult member of a couple. This is similar with Canada. In Canada, people who have lived for 40 years can receive full protection with a maximum of $707 US per month, and above 75 years, it will increase to $778 US. For people who have lived for less than 40 years, the withdrawal amount should be calculated according to the proportion of the period of residence. Although both Hong Kong and Canada have finance supporting policies for the elderly, the rates and qualifying criteria differ. Hong Kong has a fixed monthly fee based on individual's circumference, whereas Canada has a tier system based on residency tenure. Second, it will be the medical support for the elderly between Hong Kong and Canada. You can see in the picture, in Hong Kong, we are using the annual voucher amount for each qualifying senior person is 2,000 Hong Kong dollar, with a total voucher accumulation limit of 8,000 Hong Kong dollar. Elderly people are given an annual number of vouchers, which are automatically placed into their voucher amount on 1st of January of the year. They become eligible under the Elderly Health Care Voucher Scheme. On the other hand, Canada has 13 provincial and territorial health insurance plans rather than a single national plan. All Canadian residents have access to medically necessary hospital and physician service under this system without having to pay out of pocket. Provincial and territorial governments, as well as the federal government, share roles and duties for health care services. The Elderly Health Care Voucher Scheme can be used for different medical services like specialists, dentists, and so on, but the territorial health insurance plans just provide primary health care. However, Hong Kong seems having a more flexible, stable, and clear policy than Canada.
Last, that is the social services for elderly between Hong Kong and Canada. In Hong Kong, social services is aiming to enable our elders to live with dignity and to provide them with the necessary support, such as community support and care, residential care, and carer support to promote their sense of belonging, security, and merit. In the same way, Canada's social services for the elderly are typically provided through non-profit organizations, community centers, and government-funded programs. The goal is to help people maintain or improve their health status and quality of life and assist people in remaining as independent as possible. However, social services in Hong Kong are much more comprehensive than Canada's. The reason is the target audience is not only the elderly, but also the carer of the elderly. Canada had made attempts through social policy to address the needs of their aging populations. While Canada provides more financial assistance and more access to medical services, Hong Kong's social services appear to be more extensive and targeted to the individual's requirements of both the elderly and their caretakers. Which country will you choose to expand when you retire? This is our reference list.